you're pregnant and you're struggling to roll over and walk and get dressed. Feels like your pelvis is like being pulled apart or split in two, and you're wondering, is this normal? Is this gonna go away? What is this pain and why is this happening? Let's talk about it. Typically this pain's occurring in the front of your pelvis, and it's happening at your symphysis pubic, your pubic symphysis joint here, okay? This is a type of pelvic girdle pain, which just means pain within your pelvis. Symphysis pubic dysfunction is the pain within the front of your pelvis, and it hurts every time it shifts or moves, which is why rolling over, getting dressed, walking, going up the stairs, getting in and out of your car, the shower, all of these things hurt. But this is not just a typical part of your pregnancy, which doesn't mean something is wrong. It just means that this isn't from hormones and baby's positioning. However, hormones and baby's positioning can make the pain worse, but it's not the cause. The cause of the pain is an imbalance within your body between your core, your pelvic floor, and your glutes. And so your pelvis just needs more support or stability, so that way when you do things like stand up and start walking and roll over, it's not shifting and creating pain and discomfort. You're able to do this without the pain. So how the heck do you do this, and what does that mean? This means that you start by learning the basics of your pelvic floor. This is a 3-step method I teach within the Ultimate Mama Bundle. It's learning the basics of your pelvic floor. It's supporting your pelvis when you do daily activity, such as standing up, rolling over, getting dressed, those types of things. And then come exercises or stretches or strengthening to help keep your body in that position. The thing is belly bands, Tylenol, heat, all of those things don't actually fix the cause of your pain. They're just Band-Aids hoping to help get you through so that way you can survive the last few weeks or the last trimester. But it's not actually fixing the pain. So when you are postpartum, so many moms are told that after you have your baby, it's fine and it gets better, but you're still having pain postpartum because the problem was never fixed. And then you're wondering what's wrong with you and how it can get better because you're no longer pregnant. You don't have the baby there anymore. Some moms don't have the pubic pain postpartum, but they have back pain and hip pain and pelvic pain, pain with sex, they're leaking. All of these things are correlated to that pain and that problem within your pelvis. And this is very common, but it doesn't have to be this way. This isn't just a part of becoming a mom. This isn't just a part of pregnancy. This is a lack of education and support surrounding your pelvic floor. And if your provider has told you this is normal and to do these types of things, your provider does a great job at keeping you and your baby safe throughout your pregnancy. But they don't have the same knowledge and understanding of your pelvic floor or the same job that I do, which is to help you survive your pregnancy help you thrive throughout your pregnancy so you can maybe enjoy it or at least get through it without wondering if you're going to survive the X more weeks. This is what Pelvic Floor Mama is about, educating you about your pelvic floor and what it is you need to do. Okay, so instead of just waiting and hoping for the best postpartum and hoping that everything's going to be good after you give birth to your baby and after those hormones are gone, and instead of hoping that the next pregnancy after this doesn't have this pain, let's take care of it right now. The truth is there is pain later on in another pregnancy if you don't fix the cause of it now, because it's going to exaggerate itself in another pregnancy because your body's already been through it. Your body doesn't have the balance that it needs in order to feel supported and in order to not have that pain or discomfort. We're not smacking Band-Aids on it with belly bands and Tylenol and heat and KT tape. We're going to actually fix what's going on so that way you not only feel good throughout your pregnancy, but so you can have a better birth and an easier recovery because you know all the tools that you need to have in order for this to happen. So what is your pelvic floor? It's just Kegels, right? No, your pelvic floor, the basics of your pelvic floor is so much more than that. It's not Kegels at all. I don't use that terminology at all because no mama knows how to do it correctly, or you're wondering if you're doing it correctly. You're like, is that it? Is that right? Or you're recruiting other muscles and doing things that can potentially make your pain or problem worse. Truth is, a lot of moms don't need Kegels. They need less. They need to learn how to allow their pelvic floor to relax, and they need their core and their glute to help support their pelvic floor so their pelvic floor isn't tight, okay? Your pelvic floor is like a hammock in the bottom of your pelvis, and it helps support your bladder, your bowel, and your uterus. So during pregnancy, it has a lot of responsibility, and it has even more responsibility if the core and the glutes aren't working together. So back to this 3-step method that I teach in the Ultimate Mama Bundle, right? Basics of your pelvic floor. It starts with breathing, simply breathing correctly, allowing your belly to expand on your inhale and just gently coming back to neutral on your exhale. Ditching your tight bras, find something that fits you. If you need to go into maternity bras now because your breasts have changed, then do that. Find something that's not restricting your diaphragm, because tightness up here is going to create more pressure down below, and that's going to create more responsibility in your pelvic floor and more pain and discomfort. So get rid of the tight clothing, find something that fits you a little more comfortably, learn how to breathe correctly. We want you to use your core. Your body needs you to engage your core, to tighten, to help support. This helps stabilize your pelvis and helps have less pain and discomfort. So by breathing out and engaging your core, hugging your baby, supporting you that way. Picking up, I always explain, you want your pelvic floor, it's like picking up a marble with your pelvic floor. Everything's coming around it. So all these things together, working together, that is your basics of your pelvic floor. Learning how to breathe, learning how your core works, and getting your pelvic floor to not only contract, but relax. These three things together, breathing, core, pelvic floor, they help support your pelvis with daily things. Think about standing up, and if you have pain or discomfort when you stand up, a lot of times we're holding our breath and holding on to things, and we're like, oh, this is gonna hurt, and you're bracing yourself for it. But instead of holding your breath and trying to do all the movements to help stand up, think about like breathing out, engage your core, engage your pelvic floor, and then stand up. These little simple changes that you do throughout your day, that's what's going to create pain relief for you. It's not a bunch of exercises and stretches, that comes next. But the thing that you need most is the basics and the supporting of your pelvis. Then come exercises and stretches to help balance your body out, to help strengthen and stretch the areas that need it, so that we're not having constant tension in your pelvic floor. So we're not having a constant instability in your pelvis. It's the thing that comes last. If you just do stretches and exercises, it's like putting a Band-Aid on it. We're not fixing the cause of your pain and your discomfort. We're just hoping it gets better and hoping that things survive. So this 3-step method that I just talked about in pubic pain is broken down in the Ultimate Mama Bundle. This brings you pain relief within 2 weeks or less, guaranteed, by implementing 5 to 10 minutes of movement throughout your day. So that way your pelvis can feel supported, you can have less pain, you can roll over without feeling like your body's being ripped in half. So you can get dressed without wondering if your pelvis is feeling bruised or like someone hit you with a baseball bat. This 3-step method is something that's going to not only just help with your pregnancy, but you're going to have a smoother birth experience. You're going to reduce your tearing. You're going to push less. You're going to have all the tools that you need to have to recover easier without wondering, is this normal? Is this how my body should feel? When am I going to feel like myself again? The Ultimate Mama Bundle, the link is located below. Hit subscribe if you want more help and information throughout your pregnancy, birth, and postpartum, and you want to learn more about your pelvic floor. Here at this page, we are going to teach you everything you need to know about your body, so that way you can feel comfortable and confident throughout your journey through motherhood, so you can feel good after you have your babies. Too many mamas struggle with pain and peeing and not feeling like themselves and having weakness. And they think it's just because they had kids, but it's not. It's this gap in our healthcare system where you're not getting the help or the support that you need. And it comes from your pelvic floor and your core and learning how these work together. So hit subscribe below. Make sure you grab the Ultimate Mama Bundle. Start finding relief within the next 2 weeks. And make sure you come back next week for some more videos.